want to talk to you about specifically the use of imagery for getting rid of musculoskeletal pain. Since most of you are probably sitting, let's do something that allows you to get rid of whatever is a pain in the neck, be it a person or a situation in your life. But before I go there, let me just explain that there is credible scientific basis for this use of visualization as well as movement. Motor imagery activates and strengthens sensorimotor pathways that already exist. It overlaps with the neural substrates of proprioception. So proprioception and imagery are intertwined. This little snippet of an awareness through movement lesson, or an ATM, as we call them in the Feldenkrais community, is one that really uses this shift in proprioception and perception. When you learn how to use this, you can change the way you perceive what is possible, which is the beauty of the method. Visualization can also influence balance, movement, and body representation. And it's plausibly quite beneficial in neuropathy, especially when it's paired with physical and sensory input. To start with, if you would sit in a way that your back is free and you can feel your sit bones, what you're wanting to do is feel the weight of gravity through the crown of your head, through your body, into your sit bones. So bring your attention to your neck and just test your range of motion. Now, first, before you do anything, this is how you do it. You do it very slowly. So very slowly turn and let your eyes look and go to one direction, and do it several times from the middle to one side. It's a different strategy than most people do. So then when you've done that 3 times, pause to clear the slate, and then take your eyes and your neck and head and turn very slowly in the other direction and back to center. Okay, so now you have a sense of how far you can go easily, and hopefully you have a sense of what would it be like to not challenge my limitations for the sake of improving them or eliminating them, learning to bypass them. Just to make sure that you have a baseline, go to the right, turn with your eyes, and mark for yourself on the wall someplace or something, some sign that tells you how far you can easily turn your neck. And then breathe in the center and just clear, sort of like restarting your computer. And then turn to the other side and look with your eyes, mark something on the wall that tells you approximately how easily you can go or how far you can go, so you have a marker. Okay, so let that go. So this little 3-minute sequence, take your head to your left shoulder and back to center, and do that 2 or 3 times. Only go as far as you can go without any strain. Resist the temptation. It's not that temptation is a sin, it's that it's the curiosity and the go-getter attitude that we're so indoctrinated with makes us want to do more. I want you to do less. Okay, so once you've taken your head in the direction of your shoulder with no intention to touch, stop in the middle and take a breath, clear the slate, and then do it one more time, same side, take the head towards the shoulder with no intention of touching, but imagine where your head was. So that at the same time that you're taking your head towards your shoulder, you're imagining that you almost have 2 heads. Like you have a head that's left behind in your imagination, and you imagine where that was, and then you have your head that's moving and you're tracking that. And now put your hand where your head was and bring your head upright and back to the side while tracking the 2 heads, the actual head that's moving towards your shoulder and the head that's imaginary at the same time. And just notice how it slows you down. It kind of calms you a little bit to have this fully fleshed out imaginary head in your mind's eye, and then stop, rest, bring your hand down, open your eyes, and just look a little bit to your right and see if, well, and in this case, I'm sorry, it's a mirror image. Look to your left and see if you're range of motion isn't improved effortlessly without force, without stretch. Good. Okay. So neurologically, your brain is probably saying, please do the other side. Okay, so let's do it. Sit upright, close your eyes. It's not, you don't have to close your eyes, but it might help with improving interoception, this ability to really sense yourself from the inside, which we're actually quite discouraged from doing in our culture. So think about this idea that you're about to take your head towards your other shoulder without any intention of touching. And then when you're ready, start to take your head in the direction of that shoulder and be very gentle with yourself. I myself have had 3 whiplash injuries at 60 miles an hour, so I don't want to go there, but I just say this so that you know that this is the kind of thing that has really helped me have normal activity levels, whereas most people can't do, they can't ski and ride horses if they've had that kind of injury because they don't know this stuff. Okay, rest in the middle. Take a breath, clear the slate. Okay, this time you're going to do the same movement, move your head towards the same shoulder with no intention of touching. You're just going to imagine that where your head was, so that it's as if you have 2 heads. So you imagine where your head was, and you take your head towards the shoulder, and then you bring your head back, and the 2 heads merge. Do this in your own time for a few minutes. Just get into the sensate imagery, the kinesthetic imagining. See if you can feel it. And then put your hand, when you're ready, where your head is, the imaginary head is, and then bring your head back and just hold your hand there and keep imagining the head there, and take your other head to your shoulder, towards your shoulder without touching. And see if you can breathe and be free in your ribs and your belly, and soft, gentle with yourself. That's it. And stop. Open your eyes, look around, and then slowly turn your head a little bit, in this case to your right. And just notice if that place that you looked at on the wall before, if you can turn your head further than that. And have you, in fact, turn your head the other way, have you, in fact, been able to gently, using visualization and a little bit of movement with awareness, have you been able to increase your range of motion? And that's the juicy nugget for today. Thanks for joining me. I'm a Feldenkrais practitioner. If you hate stretching, this is perfect because there's no stretching involved. Okay, thanks. Bye.